Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello and welcome to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I am a family wellness chiropractor and the wellness care coordinator at the CAP Wellness Center. And today we have Dr. Michelle Wolford, a naturopathic doctor, here to talk to you about natural medicine for pediatrics. But before I introduce Dr. Michelle to you, I want to take a moment to thank our sponsor, the CAP Wellness Center, who makes this podcast possible. The CAP Wellness Center in Encinitas, California, has assembled an incredible team of fully certified holistic healthcare professionals that offer the very best in prenatal and postpartum wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. And now I would like to introduce to you Dr. Michelle Wolford. Dr. Michelle Wolford graduated in 2010 from the National College of Natural Medicine in Portland, Oregon, where she specialized in naturopathic care as a primary care doctor. She is currently the owner and head doctor at Life in Motion in Encinitas, California. The focus of Dr. Wolford's practice is acute and chronic illness in adult and pediatric patients, with the majority of her patient focus being digestion, hormones, and pediatrics. Her treatment focus is on cellular drainage through the use of natural medicine while respecting the physiological principles of the cellular excretion and revival process. Prior to medical school, Dr. Wolford was a nutritionist, personal chef, and a personal trainer. Throughout the last 10 years, she spent a great deal of time studying energy medicine as well, by studying with shamans all over the world and working with Paramahansa Nityananda out of India. Dr. Wolford has incorporated a spiritual essence into her treatment modalities and practice, as the root of most physical disharmony starts with the mental, emotional, and energetic bodies. And with that, I'd like to welcome to our podcast Dr. Michelle Wolford. Dr. Michelle, welcome.
Hi, thank you for having me.
Well, it's a pleasure to have you. I know we're going to have a lot to talk about and a lot of information to go through today. And before we jump into that, I just want to have you take a second to tell a little bit about yourself, more on a personal level in your personal journey, how you got involved with natural medicine and then specifically pediatrics. We read your wonderful bio beforehand, but what more light could you shed on yourself for us?
Okay, so I'll start with my personal journey and I'll try to make it brief. I was a college athlete and I had an injury that had put me in physical therapy for about 4 years. And my Western doctor, even though fantastic, my surgeon was like, I don't understand, like we've got you in physical therapy and, you know, we're doing all of these things. We've ran every test in the book. Like, why aren't you getting better? I had a stress fracture on my femoral neck, which is basically that long bone, so up near the hip. And I just couldn't seem to get back to my physical activity. I mean, I couldn't walk a mile without being in utter pain. I mean, it was very debilitating. So I myself started seeing an acupuncturist and a naturopathic doctor. And within a month, I could walk 3 miles pain-free. So I was like, whoa, I don't know what this is, but this is great. So that was the start to my journey. I have a background, as you've already shared with everybody, in nutrition and exercise physiology. So that was already in my wheelhouse, so to speak. And my journey continued from there. It definitely started on a very physical journey and moved to the biochemical as I began to balance out certain ailments within me, and then has definitely transitioned to being more of an energetic journey now.
So naturopathy now is the foundation of your practice, is that right?
It is, yeah. So as a naturopathic doctor, we have full medical school training, but integrated into that training is 4+ years of studying plant-based medicine, homeopathy, nutrition, alternate ways of restoring the balance of the body, the natural physical function. So that is definitely what I do. And then I just bring in a lot of the energetics when there's a time and a place and when people feel open to it into my practice.
Great. And is it, for those people that aren't maybe familiar with naturopathy or naturopathic medicine, I mean, just as you said, that you're looking at more plant-based medicines, more natural remedies, but is there a different approach, a different, say, philosophy than regular medical treatment?
Yeah, so I mean, it's in addition to sick care, so helping somebody get out of an acute illness or get out of a chronic situation, it's also wellness care. So, but the approach to both is very different than a allopathic doctor, so a Western medical doctor, from the standpoint that we do look at the physiology, so that's the natural function of the body, and then we look at the pathophysiology, which is what's going wrong, and we try to see how we can remediate that issue. So we look at each organ system individually. We look at diet, lifestyle, your mental, emotional thoughts. We look at lab reports. Sometimes those show to be fine, but somebody's still presenting with an issue. So it oftentimes is a lot of conversation. So it's understanding the experience that somebody is having in their life and how that could be transmuting itself on a physical plane or maybe on a biochemical plane. So now their hormones are off, or they have hypoglycemia, so their blood sugars are off. So I think it's just I mean, as naturopathic doctors, we have the ability to spend more time with our patients. And so I think it enables us to really get a full picture and then to begin to balance out all these different organ systems as the entire body is a team. So it's not just, oh, I've got IBS, let's just deal with the gut. I mean, there's usually other reasons why somebody would have that issue. Or, oh, I have allergies. It's not just that you have a reaction to something you're eating or something in your external environment. Oftentimes it's liver congestion and your digestive tract being off and your adrenal glands being stressed. So it's really a whole body diagnosis.
That sounds amazing. And let's turn our conversation right to the kiddos, to pediatric care. Now, obviously, on one side of the coin, kids could be easier to work with because they haven't had as much life experience yet to build up things, but at the same time, like, the kiddos can be complicated as well. You have an article that just came out just a couple of weeks ago, actually, July 30th of this year, published in the NDNR, which is the Naturopathic Doctor News and Review. And the title is The Greatest Gift, Getting to the Root with Cellular Balancing. And it really is focusing on kids' care. So can you just briefly describe like how kids' care could be different or the same from the adults that you take care of?
Of course, yeah. It actually is the same. I want to speak to your issue that it could be easier, it could be more complicated. In those cases that I find the child can move through their expression of imbalance more quickly. So any sort of expression of imbalance is going to be the signs and symptoms they're presenting with. So let's say a kid comes in with allergies, asthma, and skin issues. So when the child presents to me with these different imbalances, then sometimes it can be easier to heal because the child doesn't have, like you said, as many years on them. So their cellular system, so their body, their physiology, isn't as congested from foods that they've eaten and air that they've breathed and negative thoughts and other chemicals or toxins that they've come into contact with. I'm finding that because the number of vaccines that they are now requiring of children has increased dramatically, that kids are, not that they're harder to treat, but there's just more detoxification that actually has to happen. I don't particularly like that word all the time, but I think it's the most understood word. And then oftentimes kids can also be a little bit more challenging than they used to be because a child is not only the genetic combination of mom and dad. So everybody knows that baby is half a mom and half a dad from a genetic standpoint. But there's even that temperament, and so which is their personality, or even that energetic component. So every single thought or emotion that mom and dad has, any unresolved issue, in addition to the toxic load that their body naturally carries, also gets moved on to baby. And so I'm finding that the more and more toxic our world becomes, or the more and more fast-paced our world becomes, so the parents don't have maybe as much time to do the personal development work that they would do, or they're coming in contact with more challenges that they don't always necessarily get to resolve to completion. I'm seeing children come in with an expression of their mom and dad's issues. And it's funny, I see it, but mostly the parents will be like, oh my gosh, you won't believe this. And they're like, I had this issue when I was 18 and I didn't realize it still bothered me. And now I see it in my child. So the parents are actually even oftentimes bringing it up, which is beautiful, because if you don't see it, sometimes it can be a big leap to jump to understand that the child truly is a complete combination, mind, body, and spirit, of mom and dad.
Absolutely. I see that in my practice also, in that, how the conversation of, how health problems run in families, it's not just a genetic component, although there is that aspect too, but the lifestyles are passed down from mom to parent to the child, and thinking patterns and exercise habits and eating habits, all of those things. So those same health challenges can be passed on, not necessarily because they have the same gene, but because they're eating in the same way, they're thinking in the same way, they're exercising or not exercising in the same way. So it sounds to me like, with your approach of being able to spend more time with your clients as well, that it's almost like whole family care, not just individuals.
Yes, it definitely is whole family care. And, just to briefly piggyback on what you said, that plays such a huge role. All of those external factors can turn certain genes on or off. So you're right. You could have an adopted child that has a completely different genetic makeup, bring them into a family, and they may present with similar imbalances, the similar pathophysiology, or signs and symptoms, because all of those external factors are the same: the food, the diet, the thinking patterns, the sleep-wake cycle, everything else.
Right, and the whole new paradigm of epigenetics, which many people might be familiar with, say, Dr. Bruce Lipton's work and the like, of showing how environment turns on and off genes, so that we can have much more control over our health than, the gene theory that we're just a blueprint that we have to succumb to whatever genes we got passed down to.
Yeah, for sure.
So say a parent brings their kiddo in and they're sick, instead of going to a pediatrician, they decide to come to you. How would you start working with that kid? Are you seeing them on like a one-time visit and prescribing them things, or how does that typically work?
It's definitely case by case, especially because every child's presenting with a different issue. So typically, let's say they just come in with an acute issue. The child has never been sick and they live a happy, conscious life. They're 4 years old and they have their very first cold. So I would determine what that cold is, what the source is. Is it viral? Is it bacterial? Is it just immune imbalance? Is there a change in their external environment? And then I would give them the appropriate remedies. So the system that I use is actually out of Belgium, and it was actually based off of an acupuncture system. So each botanical and homeopathic remedy has an affinity for a particular organ system. So if it's a lung issue in orientation, I would give them a very particular remedy. And if it's kidney in orientation, I would give them a different remedy. And so what we do is we help balance that organ system of the invading bug. We help spike a fever, because fever is good. And then we help to restore the natural function of that particular organ system, so that the same type of sickness doesn't come back. So you're actually educating the immune system with these combination plant-based medicines and homeopathy. I would then see them again 2 weeks later to make sure that they've moved through the acute condition appropriately, and probably a month after that just to establish true wellness. Now, ideally, we all are undergoing some sort of wellness care. That doesn't mean that I need to see you once a month. Wellness care is probably more like once every 3 months. But let's say a mom brings a child in for a chronic issue. I would then, let's say the child has constipation and asthma. I would then do a full 1 hour new patient intake. If it's less time, then it's less time. But I like to set aside the full hour just in case. And from there, I would begin to understand why and when did this constipation actually begin, so that I can start to deduce, is it food-oriented, is it environmental-oriented, is it stress-oriented, is it just that the organ system hasn't reached its maturation? And then I would do the same for the lungs. For example, asthma is usually not asthma if the child is under the age of 7, so it's a different organ system that I would have to pay attention to. And we'll run food sensitivity tests or other tests. I can do finger pricks in office so that kids don't have to do blood draws. And And we do, the kids will get to make their own tinctures sometimes, which they really love. And in more of a chronic case, I would be seeing the child once a month until I felt that the body has reached the equilibrium that it needs, and then it would shift to once every 3 months.
Okay. I want to go back to something that you said before when treating that acute kid. Yeah. It's around fevers. I get that question all the time from moms about like trying to control fevers. Do I let them go? How high is too high? But you had said that part of your treatment protocol or your care protocol would be to help spike the fever because the fever is a natural way of the immune system kicking itself out. Like, can you tell me a little more about that?
For sure. So I actually would prescribe herbs that are more like immune modulating, meaning that if the fever needs to happen, it makes it more efficient. And if the body doesn't need to raise its temperature to help kill these bad bugs, then it will actually keep the body's temperature where it needs to be, because the only thing the body's worried about is survival. So there are times when I will offer a particular herbal combination that in some patients will spike a fever, even to 105. And, I'm like, it's okay, Mom. Like, trust me, keep your kid hydrated, and I'll give them my phone number and anything else that will help them feel comfortable. But there's often times where I'll prescribe maybe that same tincture to a child who has a temperature that's, barely breaking 100. It's 99 point, something, or maybe it's just at 100, and it won't do anything for the fever. And maybe the body just doesn't need that. So
in an immune modulation sense, it's allowing the body to do what it's naturally trying to do. It's not that it's something that is taken into the body and it just produces a fever.
Exactly. We're not forcing. That's the thing about natural medicine. I think that's the biggest difference with natural medicine versus pharmaceuticals, is natural medicine for the most part are all adaptogenic or regulating, meaning that it will only do what the body feels is in its best interest. So the herbs and homeopathy make suggestions, and the body then says, okay, I'm equipped to follow this suggestion, or no, I'm not quite there yet. Whereas an actual pharmaceutical, there's no asking of the body. There's no respect to what the body may or may not need. It actually sends a chemical signal and makes something happen.
Right. In the same way that, taking a prescription drug to lower a fever, it would possibly perpetuate the sickness because the body's trying to kick in a fever to help burn it out as a strategy.
Yeah, and as a matter of fact, I have this conversation with my moms and dads all the time, is it's really important not to take that Tylenol or that Advil to suppress that fever, because you then begin to train the immune system not to do its job. And it causes, for some people, autoimmune diseases much later on in life, or it can prevent the body from actually excreting, so breaking down and excreting the material that the body doesn't want in there anyways. And so that becomes one new layer of physical or cellular congestion, not only because you're putting the pharmaceutical in, but also because this material that the body is trying to kill off, burn up, and get out, it's being told, oh, don't worry about it.
I've never thought of it in that way. I've made the same recommendations to parents around not taking the Tylenol or Advil, but only one, we don't want to control the fever. If the body needs to produce it, and as long as it's not going too out of control, then allow the body to do what it needs to do, and for the toxic load that the Tylenol or Advil will produce. But I hadn't ever thought about that your body's patterning into the drug doing it for it and compromising your immune's capability later on. That's really interesting.
Yeah, definitely. Mm-hmm.
As far as, so then going on to kids that are coming in with like more chronic issues, what are the main health problems that you're seeing in a chronic condition with little kids nowadays?
A lot of repetitive ear infections, asthma, allergies, ADD, / any type of behavioral issue. I even have been seeing an increase of autistic kids or kids that have been placed somewhere on that autistic spectrum. And I used to see a lot of skin stuff, but for some reason I haven't been seeing a lot of skin, which usually goes along with allergies and asthma. But I would say, and then obviously the GI stuff, whether it's constipation or diarrhea. I would say those are the biggest. I'm also in my older pediatric population, which is almost teetering on adult, so that 15, 16, 17-year-old, technically they're still pediatrics if they're under 18, is I'm seeing a lot of hormonal imbalances that are fairly new for us. Like the hormonal imbalances generally started in the 40s, and then it kind of became the 30s, and then it became the 20s. And even in talking to a lot of my mentors, because I'm much younger in my practice, but my mentors that have been practicing for 30, 40 years, is they would tell me, we've never seen kids in their teens having these hormonal issues that now I'm seeing 9, 10, 11, 12, 13-year-old kids having.
That's incredible. I'm also seeing in my practice a lot of like repetitive strain injuries with the kids playing the same sport year round, which is a total different way than when I was growing up. I was very active, but we had a season. We played baseball for a couple months, and then we took the summer off and we played at the beach, and then we played soccer, and then we did that, and it just rotated. But now what they're calling the professionalization of sports, or of kids sports, I should say, they're kind of starting baseball and they play year round, and I'm working on shoulders and knees in the way that I work on with the weekend warrior dads and moms.
Yep.
So that's a disturbing trend to see that those hormonal balances are coming along, and I would imagine with the degree of toxicity that's out there in the world as it is now, parents would have to take even more of an initiative to try and do as much as possible inside the home to limit that toxicity.
Oh, 100%. I went to a lecture, 5 years ago, and it was a naturopathic doctor and a group of MDs that were speaking on environmental medicine. And they said the most toxic place in our environment is actually inside our home.
Is that right?
Yeah. I mean, maybe not as much now because we're starting to see I don't want to use the word fad, but the fad of, natural cleaning products and not as many perfumes. And, we're starting to see some changes in all the chemicals that we would have normally naturally used in our home environment. But before, if you can imagine, it's a contained space where there's constantly the spraying and the use of chemicals, from our detergents to perfumes to toothpastes to maybe people not eating organic and getting it on their herbicides and pesticides, like on their food, to the air that you breathe. Everything. Shampoo, conditioner, lotion.
Well, it makes sense with all that exposure, and with your approach talking about cellular balancing and really on a cellular level detoxifying the cell, if that is that an appropriate way of describing what you're attempting to do?
Yeah, it's but to take it one step further, if you can imagine a bubble, like a circular space, and calling that the cell. The uniqueness about a plant-based and a homeopathic combination is that it doesn't only get that space outside the bubble, so that extracellular space, but it actually can go inside the bubble, so inside the cell, so in the intracellular space. And that is when the magic really happens, because you're not only cleaning up your internal terrain, but you're actually getting inside the cells, which do their own version of pooping and peeing, so to speak, and you're kind of just making that also more effectual. So you're in essence speeding up the process, but only doing what the body can handle. So again, this isn't about forcing anything. This isn't about chelating. This is about asking the body to remove the toxic load from outside the cell and inside the cell at the physiological dose. So all that the body can truly handle without any sort of damage.
That's fascinating and so powerful.
Oh my God, yes.
And powerful for a parent to think of being able to have a child under this type of care or monitored in this type of way right from the get-go. So there's less and less of that detoxifying process that needs to happen. And then in my thinking of it too, it has allowed that child to have more flexibility and adaptability to what is in the world without having to wait for things to gunk up and then go and get sick and then go and receive care.
Yeah, of course. Yes, definitely.
Well, this is all fascinating information. And in the show notes, I will have a link to your article so our listeners can listen to that. But then also tell our listeners how they can get in touch with you. What's the best way if they want to take some next steps?
Okay, yeah, for sure. So you can always call our clinic, and that number is 760-230-2270. And then my website or email. So the website is lifeinmotionmed.com, and the email is actually info, at drmichellewolford.com. And I'm sure you'll provide the spelling of all of that, so I don't need to go into that.
Right. No, we'll put that in the show notes as well, and we'll be dedicating a page on our capwellnesscenter.com website to this discussion. You'll be able to get those links, so you don't have to write them down if you're listening in the car or on a treadmill right now, listening to the podcast. So I have just two last quick questions for you before we wrap up our podcast. And the first one is, Dr. Michelle, like if there's one thing that you could have the mom or the mom-to-be listening right now really take to heart and take away from our discussion today, what would that be?
Jay, can I say two things?
Yes.
Okay. So the first thing that came to mind is I think it's really important that moms understand that baby will take absolutely everything from your body. So I have some patients that have chosen to, in the past, to discontinue care throughout their pregnancy because they're like, oh my gosh, my skin issues, my asthma, all of this stuff went away. And it's like, well, yeah, because baby's taking your toxic load, which is helping you feel better, but that doesn't mean that baby's not getting it. So whether or not you're balanced before or during your pregnancy, I think that it is really important to continue that care to make sure that, one, baby isn't actually, in fact, getting your toxic load. But two, also ensuring that since baby is taking everything, that means that the child is getting your vitamins, your minerals, your essential fatty acids, all of the good stuff too. So it's about making sure that mom is actually fully supported, even if she feels totally healthy and optimal and has had this beautiful journey prior to conception, is that still making sure, whether it's on a physical, a biochemical, or emotional level, that she is also being supported throughout the pregnancy as well as the child. So that would be my first tip. And then I guess my second one kind of goes along with that as well, and it really speaks more to the energetics. I think it's really important that people be brave when they have to face certain situations in their life. And because I see so many moms, I hear so many different stories about their experience prior to pregnancy and then throughout the pregnancy. Just, fears or worries or things that happen in their everyday existence. And I would just say if you could be really brave, and whether that means, having a flower essence made so that it could help you on with that emotional journey, or getting an energy cleansing, or taking different homeopathic or naturopathic remedies, all of which I and a lot of naturopaths can do everything I'm talking about right now. It's important because anything that you're experiencing, physical or energetic, so is your child. And so as you are facing these challenges or these beautiful gifts, so is your child. So you're literally writing and expanding your life as well as this child. So being brave.
Well, that's a beautiful message and great wisdom. Now, the last question I have is, just as you were just talking, is for the babies. If you could whisper one piece of advice or wisdom into the ear of the little baby whose parents listening right now, and whether that baby is here or maybe on their way, what would that be?
I would say to love yourself always for who you are. We're here for the human experience, and that human experience is about learning and growing. So you'll make mistakes and you'll have achievements, and there's times where you feel like you'll fail, and there's times where you'll be just so consumed with joy and bliss. You'll experience every emotion, and you'll attract everything into your life that you want to experience. So just really loving yourself and being kind to you, because there's nobody else like you in the world, and the world needs all of us. So to really just show up in your most authentic space and love you for who you are.
And that is beautiful too. Thank you so much, Dr. Michelle. It's been a real pleasure talking with you. Your caring and your expertise really shine through, and I'm pretty sure everyone listening to that will feel that as well. So thank you so much for being here with us today.
And thank you, Dr. J, so much for having me. I really appreciate it.
Well, and hopefully we can have you back soon, and we can explore other topics as well. Yeah,
that sounds great. I'd be up for it.
Well, that sounds great. Well, take good care of yourself, and we'll see each other next time.
Okay, talk to you soon.
Bye-bye.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the CAP Wellness Center look forward to helping you and your family be as happy and healthy as you can be.